Time now for this week's Health Matters. Paul Critz, along with physician assistant Lynn Szabo. And we're joined this week by a special guest. And I'll just go ahead and introduce this special guest, Lynn, if it's okay with you. And then we can talk about why we're speaking with this special guest. Laura Roberts, registered nurse at UIHS, United Indian Health Services. Is it services, the S? Is that what that is? I forget.
Absolutely.
And Laura is on the phone with us. Good morning, Laura.
Good morning.
So you are here not just as a registered nurse and a healthcare provider, as Lynn is as well, but also specifically as a CPR instructor. And Lynn, why are we talking about CPR today?
Because I just had to re-up my CPR, and I've taken the class multiple times. I took it this time from Laura, and I noticed a lot of big differences that I thought people needed to know about, and hoping to inspire at least one person to go and get certified, because it really is easy and it's super important.
So Laura, let's start with some really, really low-hanging fruit as far as questions go. Why should people know CPR?
Well, CPR stands for cardiopulmonary resuscitation. And so cardio meaning the heart, pulmonary meaning lungs, and resuscitation. So we do CPR when the heart stops functioning and pumping blood out to the rest of the body. And when that happens, death usually occurs within minutes. And under the umbrella of CPR, there is a couple different subcategories. ACLS, which is Advanced Cardiac Life Support, and BLS, Basic Life Support. And with BLS, that is really the basic and foundation of resuscitating and bringing the patient hopefully back alive again.
Yeah.
Yeah, hopefully that's the goal, right? So
that's our goal. Yes.
So
yes.
I don't know. I'm going to step back. You dive into this. This is all different to me, and I am intrigued by the fact. Like, I learned CPR for the first time, and I'm pushing 60. I learned it for the first time in what was called back in the day junior high, and I guess it changes over time as our understanding of how to bring somebody back from the brink of death changes. How much has CPR changed over the years?
Well, CPR has changed quite a bit. It used to be the ABCs, airway, breathing, and compressions. Mm-hmm. And there has been several studies done throughout the years that actually show that airway and breathing is not as efficient as actually doing the compressions and pumping the heart. So now it's actually turned to CAB with emphasis more on the compressions and then secondary airway and breathing.
Right. That's what blew my mind. That's also why I found it so much easier, I guess. It seemed more logical to me. The other thing, too, is that without the emphasis on artificial respiration, I really felt like it took away an icky factor that some people might, it might be a reluctance, perhaps, inspire reluctance to do CPR. It's kind of, it's kind of amazing too, that there is oxygenated blood in the body. You just have to move it around.
Correct. Yeah. When the heart actually stops, usually there is, a last breath or two that then puts oxygen into, the person's blood system. And so it's primarily now focused on moving that oxygenated blood throughout the body versus, attempting to get in air. And it used to be the old school, mouth to mouth, pinch the nose, tilt the head back, with no barrier devices. And now, and that was kind of maybe a put off to some people of, ew, I don't want to put my mouth on that person. I don't know who they are.
They just vomited.
And it can happen. Mm-hmm. It can certainly happen. Yeah. So now the emphasis, is more on actually being the pump of the heart and moving that oxygenated blood throughout the body and back up to the brain.
Yeah, I found that actually, you're actually being somebody's heart.
So is there like a time? Do you only have so long that you can do that? I would assume there would be sort of a time in which the oxygen would be depleted.
Well, yes. So when you're performing BLS, basic life support, or CPR, we do have to attempt at getting some air back into the person's body. But it's a brief, you have about 10 seconds to attempt at getting some air in. And with each try, you want to just give enough air to see the chest rise.
Okay.
Yes.
So you're not leaving off breathing entirely, right? You are adding some air into it.
Yeah.
Yes.
Thanks for the clarification. Yes. Also, you can use assistance devices.
Oh, yes. So when you're doing BLS, and I think it's kind of maybe important to talk about the heart for just a minute, because the heart is actually a two-piece organ, maybe. It does work mechanically as a pump. The heart does squeeze, which then moves the blood throughout the system. But there's a small electrical component to the heart. There is some tissue within the heart that does conduct electricity, which tells the heart to actually physically pump and move the blood. So when that electrical system goes haywire, that's what causes the heart to stop pumping. And within minutes of the heart stopping pumping, the person actually passes. That's the critical moment. So when we're doing BLS and CPR and we are doing our compressions on the sternum, what we are actually is we are acting as the mechanical portion of the heart. So we are pushing down on the chest rather quickly. There is a rate. We want to try to get 100 to 120 compressions. That's our time. And you do 30 compressions, and then you do pause for a moment to try to get some air into the system to then go directly back to doing those compressions again.
Wow, that's actually really quick, isn't it?
It is very quick.
And you're talking like 100 to 120 compressions a minute? Is that what you're shooting for? Like the equivalent of 120 beats a minute?
That's staying alive from...
Yeah, that's what I've heard before. Yeah, there's a funny.
I find that
scene.
Actually pretty helpful.
Yeah, you can sing it quietly to yourself, or please, staying alive, staying alive.
It's actually hard to get 100 to 120 beats per minute. It's also hard to remember what good quality compressions are. So we used to be taught 2 finger breaths from the base of the sternum and then the palm of your hand, and then, kind of raising your fingers up so you're not really breaking ribs and stuff, although that happens. And that's exhausting. That really is exhausting. But it seems to me there's less of an emphasis on the particulars of it and more of an emphasis on kind of a renewed understanding of what's really important. What would you think, say, Laura?
Yeah, it is very exhausting, especially when it's just 1 or 2 people, trying to resuscitate somebody. The compression of it is, yes, it is very tiring. It takes a lot of strength and pushing down. So when you do a compression, like I said, we are acting as the mechanical pump of the heart. So we need to be able to press down that sternum bone at least 2 inches on an adult.
Whoa. That sounds like a whole bunch.
Right. So you got to line your shoulders over your hands and you got to go for it.
You've got to raise up above and use your body weight and stuff like that. It seems like it'd be awful easy to snap someone's sternum like that. I guess that maybe is a common thing you have to watch out for.
It can happen. It probably will happen.
Okay.
Because yes, it is deep, and yes, there's a lot of emphasis more on not just pumping and moving the blood, but also doing it correctly as well. We need to be able to push down that 2 inches and then let the chest fully recoil. Because if you just get a lot of pressure going down, we're squishing the heart and pushing all the blood out of the heart and out into the body. And if we don't allow that sternum to come back up and allow the the heart to fill again with oxygenated blood, then we're just squeezing and nothing's
right.
Nothing's moving.
It's like having a sponge and you keep squeezing it, and it doesn't have a chance to soak up any more water. The
Exactly.
So can you take us through what a good compression would look and feel like?
When you're doing compressions, you want to have the patient being on a hard, flat surface. If you're on a soft surface, you're just pushing the patient down into the couch or the bed or whatnot, and you're not able to get that depth that we're looking for. So the patient does need to be on a hard, flat surface, so the ground, and then down on your knees, directly next to the patient. You can do two hands, either interlacing your fingers or just palm over palm. You want to put the palm of your hand about the nipple line of the patient, right there on the lower portion of the sternum. And then with your shoulders directly over both your hands, that's when you want to push down the 2 inches and then allow the chest to fully come back up. And then it's down, up, down, up, down, up. It's quite tiring.
Only faster, yeah.
And Staying Alive's like a 5-minute song, so you're in for that too.
Yeah. Well, you just keep repeating the important part.
Yes. It's just compression, and you want to do the compressions, 30 compressions before we pause, and then focus more up towards the patient's head tilt, chin lift. If you are okay with doing mouth to mouth, if it's a family member, a good friend, maybe a small child, then that's when we head tilt, chin lift. You can pinch the nose and attempt at giving 2 breaths. Or there's also lots of different types of barrier devices that are out there. In the medical world, we're in clinic. There are rigid face masks. That's kind of what a lot of people, that's what you think of when you think of CPR and doing rescue breaths. However, there is a lot of pocket shields that people are carrying on their keychains, and they kind of look like a plastic bag with a one-way valve on them. And so people are using those. So if one is available, you can put it over the patient's face and then go ahead and give 2 breaths and then go right back to doing the compressions again.
I'd also like to maybe just kind of walk through with you in a make-believe encounter with somebody in which you would have to judge, whether or not CPR is warranted, and then go through the motions of cardiopulmonary resuscitation.
Because you don't want to go wailing on somebody that doesn't
right.
need it. Yeah.
So Laura, let's say you encounter somebody and you have reason to believe that maybe their heart isn't beating.
Yes.
Where do you start?
So if you're taking a stroll through the park and you notice that somebody's laying down on the ground, first thing that you want to do, number one, you always need to make sure that the scene is safe. Pardon me. Depending on where they're laying, are they in water? Are they laying in the middle of the road? Is there traffic around? Is there, any kind of hazards? Because if I'm going to put myself in danger, I'm certainly not going to be able to do anything for my patient.
Exactly.
So scene safety is where we start. Just take a look around, make sure that everything is safe. Number 2, we want to go up to the patient and, see are they just laying there in the sun taking a nap? So we want to approach the patient and hey, kind of try to wake them up. Are you okay? See if we get any type of response out of the person. And then I still call it stop, look, listen, and feel. We want to feel for a pulse, and it's the carotid pulse is what we feel for, which is in the neck of the patient. And then we also look to see if they're breathing. So it could go a couple different ways. If we feel no pulse and we don't see any, signs of breathing, then we want to start. Well, we want to make sure that we're calling 911 and get some help on the way.
Yeah,
Everybody
right.
has a cell phone. Everybody has a cell phone these days. So call 911 and then dive right into those chest compressions.
That's different from the old way of doing it. It was 2 breaths first. So dive
really
into
started with the breath and then okay.
So dive into chest compressions.
And you used to do, and I don't want to muddy it, but you do like 5 compressions and then another breath, right? Something in the old days.
30.
30.
I know that's what it
Oh,
is
in the
now. I'm
old
talking
days,
about in
yeah.
the 80s, back
Yeah.
when people died all the time. So,
Back when people died all the time.
so yeah. So that's all out the window. I don't want to muddy the waters by throwing out these other numbers. Now it's 30 compressions. You begin right with the compressions and not with the breath.
Jump right into the compressions.
Okay.
Yeah, because the chances are, especially if the person has just recently gone down as far as, their heart stopped, there is still some oxygenated blood. So yes, we dive right into, so you want to right into the compression. So you want to, make sure that, number one, that they do not have a pulse, because if they do have a pulse, please don't go jumping up and down on them. So you do it until you're relieved, until more help comes on the way, or until you just physically are exhausted and can no longer go.
Wow.
And that you're covered then under the Good Samaritan law, the Good Samaritan Act, that if you start compressions and CPR on a patient and you just can no longer go and you have to stop, and unfortunately the patient, passes and we're not able to get them back, you cannot be held liable, for stopping.
Are there times when you
CPR.
can? Are there times when you can be held liable?
I don't believe so. I do believe that CPR is covered under the Good Samaritan Act. So as far as, family members coming back and saying, well, you didn't do it long enough. Well, I attempted and I did everything that I could within my wheelhouse, within the realm, to attempt at saving this person.
Right.
So I don't believe so. I believe that you're covered under the Good Samaritan Act.
Okay. Wow. So,
So the other things we learned in the class was the Heimlich maneuver, which is no longer called the Heimlich maneuver.
what did they take the guy's name off of it?
Yeah, I don't know why.
That's
Do you know
wild.
why, Laura?
Was he
They
canceled? Did he do something
did.
bad?
What did Heimlich ever
Was
do?
he canceled?
The truth came out about Heimlich, and that's it.
Yeah. I'm not sure exactly. The name has been, what's the word that I'm looking for? The name has been coined or whatnot. So now it's just referred to as abdominal thrust. It's still performed the same way. It's still, taking a fist and with your thumb side on top of your fist. You don't want to curl your thumb over. You want to leave your thumb on top. Wrapping your arms around the patient and just above where the navel is. So you give them a big old bear hug, and right above where the navel is where you want to place your hand. And then it's quick inward and upward.
And this
on the
would
body.
be used if somebody was choking.
If somebody's
To be
choking,
clear.
yes. We're trying to kind of induce a cough, in other words, and
Right,
try to
right.
move that air that's in the lungs up and out to dislodge. Yeah.
So,
But yes, it's no longer called the Heimlich anymore. It's just referred to as abdominal thrust.
that just seems so confusing and needless. Everybody knows the Heimlich. If somebody said, "Hey, that person
Everybody
needs
knows the
abdominal thrusts," I wouldn't know what that was. Is that like a workout?
I know.
Am I going to get a six pack if I do this too much? Maybe.
Exactly.
So, what about? I remember that always being a special sort of subset of CPR training in the past for infants and children. Is that something we can discuss?
Yeah. Oh, absolutely.
Okay.
Yeah. So pediatric. So when you're talking kids, it's kind of broken down into two more groups. Pediatrics, which is within the American Heart Association, we consider that a child from 1 year through puberty. Puberty being breast development on girls or underarm hair on boys, so things do change just a little bit when we're talking pediatrics. If you find a child down, we automatically start into CPR versus if we see a child fall and go down in front of us, then we are to leave and go call help, return back to the child, and then start CPR.
Okay.
And CPR for a child is if there's only one person, so you're just a single rescuer, it's still performed just like we would on an adult. It's still 30 compressions to 2 breath ratio.
Okay.
Yes.
So the same thing. I
And-
mean, but and other concerns as far as maybe you don't have as thick a sternum, things like that. Do you need to be more careful with the compressions?
Well, it's still depending on the size of the child. I've seen some rather large 10-year-olds, and I've seen some very petite 4-year-olds.
Uh-huh.
So there is kind of a rule of thumb as far as the compressions and the depth of the compression. The rule of thumb is 1/3 the depth of the child's chest is how deep you want to compress.
Wow.
So if it's a bigger child, it may be the better part of 2 inches.
Mm-hmm.
If it's a smaller child, it may only be about 1.5 inches depth.
Okay.
So we kind of just use the rule of thumb is we want to compress about 1/3 the depth of the child's chest.
And then for infants, you're just using your 2 fingers. So you're not using the heel of your hand.
Yes, in infants, and so on pediatric patients, they are a bit smaller. That can be done single-handed, depending on the rescuer's upper body strength. You can use the palm of one hand, or you can use 2 hands, whatever it's going to take to get 1/3 the depth of the chest. On infants, and we're talking 1 year and smaller, so a 20-pound or less, patient. Yes, we do just use either the index and the middle finger to push down on the sternum, or you can use 2 thumbs and kind of encircle the baby's chest and then use your 2 thumbs to do the compressions.
Okay. Yeah. That kind of gentle squeeze kind of thing. Okay.
Yes. Yep.
So
Wow.
a lot to learn. So one thing that I remember about your class is that from other classes is it used to be the instructor would go around and there would be like a pretend CPR procedure, and then it seemed like high value. Everybody was nervous, but you just kind of watched us as you were also instructing. And I thought that really lowered the stress level about having to do it perfectly. And I thought that
To
was
perform in somebody.
yes, exactly.
Yes.
I'm-
Nobody wants to be looked at in the middle of the class and have all eyes on them, especially
Right.
when we're learning.
especially,
Yeah,
I would say if you're the provider, because we're supposed to know how to do it perfectly, but it's a learning curve for us too. And then the
Yes.
same thing for the test was super collaborative. So I think anybody who's interested in taking CPR, perhaps they have an elder at their house, or they just want to be available, to help when they need to. It really is not the stressful event that it used to be in the past. It really is more collaborative, more cooperative, super easy to go through. I think we were done in about 3 hours. And
Yes.
yeah, I super
Yes,
appreciate
the classes. Yeah, the classes are. I apologize about my barking dogs. The classes are pretty easy these days. We try not to put anybody on the spot. Me as a teacher, I want to make sure that my students are doing things correctly. I don't want them to feel stressed out. I don't want them to feel pressured. I'm focusing more on technique and watching technique. And yes, there is, through the American Heart Association, in order to get your certificate through us, there is an exam at the end. Nobody has to be scared about taking a test. We just want to make sure that the basic fundamentals of the compressions and the airways and the timing and the rates, is known before we say,
Right.
"Yep, you're good. Go ahead and
Yeah, absolutely.
go save the world."
But I think that collaborative approach leaks through into actual code situations that I've seen in the ER, where usually led by the physician, but super team approach. And when they get down to the point where they have to let someone go, the physician will say to the people who are doing CPR to the team, does anybody have any other ideas? Is there anything else we could do? Is there anything we could do differently? And I think it's way different than, what you see on TV, maybe
Is
where there's this dominant physician,
right,
and everybody
who
else
has
is
to
terrified.
look at the clock and call it, and it's official, and there you
and
go.
throws
and all
things
that.
around and
Right.
curses and stuff
No,
like
it's
that.
more a room full of humans reacting to the death of another human.
Yeah,
Wow.
absolutely.
Okay.
So, not very many people are going to be in the ER seeing that, but I think you guys are intentionally teaching a really collaborative approach, and I felt the difference in your class. I thought that was really, really good.
That's interesting. Wow.
Yeah, thanks for that,
Good.
Laura.
So
Sure.
how often does one need to be certified?
Well, to keep up on, a certification, the certificates really do expire every 2 years. So anybody that's working, in the medical field, we have to keep ours, we have to keep ours active. So we
Right.
do have to recertify every 2 years. But if somebody just wants to go and take the class and get certified, if they don't, need the license, they just want to go and be taught and trained and understand the concepts and know how to properly do compressions and airways. You would take the class once, and then if you want to keep up on your skills, you take it every 2 years. Otherwise, you go and get taught and trained and understand the basic fundamentals, and you don't necessarily have to re-up every 2 years.
Well, I don't know. It's changed so much since the last time I was cognizant of CPR at all. I think it's a good idea for everybody to check in and see how it's changed.
Where does somebody go to get certified? And we're broadcasting to a larger area than usual, and I'm wondering, do they go down to their local fire department?
Yeah,
or
good question.
Where? Yeah.
Yes. A lot of fire departments do host and teach basic life support, BLS. Also, your local hospital may have courses that are available. You can certainly go online to the American Heart Association, and on their website, you can type in your location and look for classes near me, and they can help steer you. The Red Cross, I do believe, hosts BLS classes. So there's a number of different ways that you can get connected with a course.
Yeah, I would advise not to do one solely online without the actual mannequins and the hands-on.
Right,
I think
right.
that adds a lot,
Yeah.
although that is possible.
Yeah.
So,
That is possible, yes. There are online courses that you can do, but until you actually play with a mannequin and see just how exhausting it is and, get the proper technique. I would advise anybody, especially if this is their first time looking into taking a course, is doing a hands-on course versus an online.
Right. Well, Laura, we're just about out of time. Any last thoughts? Anything you'd like to leave our listeners with?
Oh, I just encourage everybody to look into taking CPR. It is very effective at saving lives. Their heart can stop at any time for any number of reasons. People don't necessarily need to be, have a cardiac condition. It can be electrolyte imbalances. So people, can go down at any time, and it is highly effective. So I do encourage everybody out there to take a course at least once and have those skills, because you never know when you're going to need them.
Wonderful. Laura, thank you so very
thanks,
much.
Laura.
Laura Roberts,
welcome.
RN with United Indian Health Services and a certified CPR instructor. And she's just dropped a bunch of knowledge on us, CPR-wise. So, wow. That was really informative. That's really super cool. I'm not going to go out and actively seek somebody to do CPR on, but I feel much better, much more prepared.
Right on. You look more prepared.
Thank you.
Lynn, what's on deck for next week?
Oh gosh, there's so many things. I'm kind of on fire about well-child checks, so that might be it.
All right. The next Health Matters. Keep it here. Thanks.